Understanding a child's development is a crucial way to create a framework of what resources a child needs. I personally did an assessment of a 1.6-month beautiful baby girl, and I immediately identified that there were strong biological strengths. This infant, in particular, is in a home where there's no exposure to alcohol, smoking, no known exposure to any teratogens. Also, the parents are very educated on the nutrition that the infant needs. But also, using the ages and stages of questionnaire, I was able to identify that the infant lacks in the fine motor skills and problem solving skills. During the interview, I started to observe that the mother held the infant really tight and close, and we started to talk about what the day-to-day routine is that she does with the infant, and that is pretty much the routine, holding the infant really close and bundled up. And we talked about that the infant needed more active, being physically active. And we talked about the 10% time when an infant is quiet yet alert. And to utilize that time and identify this alert state is the ideal time to be physically active with the child. The mother in particular, I learned, had no role modeling growing up. She had no mother figure and felt very limited in her abilities as a mom. So as a whole, I was able to identify how positive role modeling and teaching, for example, the basic game of peekaboo, tummy time, and also how to make objects in a distance to where the infant will have to reach for it and really develop that fine motor skills was more effective and allowed me to, as a social worker, knowing the child's development, where the infant needed to be, put my attention where it needed to be, use my time more effectively, and allowed more for accurate recommendations in getting clients to the right resources. As a whole, the ages and stages questionnaire was very effective. It was a great tool. For the Southwest population, there's a large population of bilingual, where English is the second language. In this particular case, the mother English was the second language, and I immediately saw the limitations of the ages and stages questionnaire. For example, when it asked, "Does your baby chuckle softly?" "What does chuckle mean?" she asked. "Is there hearing impairment?" "What's an impairment?" After recognizing some of these limitations, I asked if she'd feel comfortable if I would fill it in for her so she could talk and get more of her thoughts out, and she was very grateful for that opportunity. So I used actually the age and stages questionnaire as a facilitator to facilitate an interview, and I got a lot more from the mom, a lot more information by doing that. One thing I also noticed that was a slight limitation on the ages and stages questionnaire, there's not a lot of place to gather information about the medical history or the pregnancy and birth. So I did more of a personal interview to gather that information, and I found that experience to be critical to learn about the emergency C-section that had taken place, the trauma that had on the mother, also the past experience and current experience of the mother feeling isolated, so the infant is not really getting any social interaction besides just with mom. And as a whole, understanding the cultural context of the mother and how that directly affects the infant allowed me to facilitate a better interview to make sure I was repeating what the mom said so she felt heard. And as a whole, the age and stage questionnaire was very beneficial to identify the appropriate age development that needed to take place. And as a whole, an interview was the final piece that really helped put everything together, the recommendations I would give the mother, especially to get out in the community and join what Norway has is the local support group for just mothers that in that same demographic area. So as a whole, very effective tools. I would use them again, but definitely take into consideration the cultural and the language limitations that the age and stage questionnaire has.